The urolithiasis. Urinary stone disease or urolithiasis is a disease in which the main symptom is the formation and the presence of single or multiple stones in the urinary tract system, calyx, pelvis, ureter, bladder, or urethra. Classification of urolithiasis. According to the localization in the organs of the urinary system, it is the urolithiasis in the kidneys, nephrolithiasis in the ureters, ureterolithiasis in the bladder, cystolithiasis. According to the type of the stone, can be urates, phosphates, oxalates, cystine stones, and other. According to the course of the disease, the primary stone formation and recurrent stone formation. The specific forms of urolithiasis like coral kidney stones, single kidney stones, and urolithiasis in pregnant women. Types of the stones. Cystine stones are X-ray positive, they contain sulfur and are yellow in color. Triple phosphate stones, radiopositive, more common in women and catheterized patients, sources of urease-producing bacteria, and the stones are large in size, perform pelvis and calyx. Types of the stones. Phosphates, white in color, formed in alkaline urine, X-ray positive. Oxalates, dense with the spikes, X-ray positive, they are hardest and hardest to break the stones. Urates are yellow-brown in color, hard, X-ray negative. They are formed by overeating and excess uric acid. Carbonate stones, formed from the calcium salts of carbonic acid, X-ray negative. Protein stones, formed mainly from fibrin with an admixture of salts and bacteria. They are white, X-ray negative, and soft. This is how looks like the urate stones. This is how like oxalate stones. The Stockhorn stone. Big, complains all pelvis and hard to treat, but we have the such treatment like percutaneous nephrolithotripsy, which removed all this stone. It is the X-ray method of investigation, which named plain urography without contrasting. Where you can see these big two stones. Normally kidneys are not detected on the plain urography, but they are detected due to the big stones. The symptoms of the urolithiasis. Renal colic, which is acute impairment of the urine passage through the urinary tract. The pain is sudden, with periods of relief and repeated attacks. The pain is localized in the region of the kidney or along the ureter and has a typical irradiation down into the iliac and inguinal region. The initial point is local spasm of ureter, which leads to the intravesical hypertension and pyeloctasia. There is a disturbance of renal hemodynamics, arterial spasm, and venous stasis. Venous stasis in the kidney contributes to the stretching of the fibrous capsule and irritation of pain receptors. Hematuria occurs as a result of a sharp increase in intravesical pressure during the renal colic, with the formation of the pyelovenous reflux, urine flooding into the venous channel, which is manifested by total microhematuria after the collapse of renal colic. Also, when a nodule passes through the ureter, the latter may be injured. Symptoms of urolithiasis. Pyuria or leukocyturia, an increase in the number of leukocytes in the urine, indicates a urinary tract infection. Dysuria, impaired urination in the form of frequent urination, is usually formed when a nodule is located in the lower third of the urethra, or when there is a large nodule in the bladder. Anuria is the absence of urine due to the impaired outflow of urine, possible with stones of both ureters or with the urethral stone of the only kidney. The radiological diagnostics: X-ray examination, ultrasound, and computer tomography. X-ray examination: you can see the stones here, the big stones here, and here. There is the Stockhorn stones. And here we can see on the plain urography the big stone here. The plain urography, and here's the plain urography. The plain urography and excretory urography, you can see there is the we have now detected the kidneys, and here is also, but with intravenous contrasting we can see the pelvic calyceal system here, and ureter and urinary bladder, and here the pelvic calyceal system and ureter and the urinary bladder. So here is the BPH and urinary bladder stone. The big stones due to the disturbance of urine outflow in the lower urinary tract. And here is the 11 years boy with urinary bladder stone due to the neurogenic bladder, I guess. The plain urography, a left renal pelvis stone in 10-year-old child. Here is. And the left coral stone in the 8-year-old child. Here we can see also. So multiply right kidney stones and the coral left kidney stone in a 6-year-old child. Here the one, and here the second. The coral kidney stone and single pelvic left pelvic stone in a 14-year-old child also. The plain urography of the kidneys and urinary tract stone in the upper third of the left ureter. Here we can see him. The left kidney and bladder stones in the 5-year-old patient. B. Ascending ureteropelography, narrowing of the pelvic ureteric segment, pelvic stone in the 4-year-old child. Here we can see one stone, and here the second. And here is the segment of the pelvic ureteric segment with stenosis. And here maybe the stone. The plain urography, urinary tract stone in 2-year-old boy. Here we can see it. So the excretory urography, we can see the hydronephrotic transformation of the kidney and the stenosis of the pelvic ureteric segment. Here we can see the problems with the ureter on the lower third of the ureter, close to the urinary bladder, and here we can see the urinary bladder stone. This is the kidney in the stone in the kidney, in the renal sinus. Here we can see the ultrasound image of the kidney stone. Here we can see the kidney stone, and here, and here. The ultrasonic examination of bladder stone, the hyperechoic structure with acoustic shadow size 34 up to the 22 millimeters. Here it is. And the ultrasound of the bladder stone, hyperechogenic structure with the acoustic shadow size about 48 millimeters. Here we can see it. So the CT scan from the left to the right. Contrast encased renal CT, arterial phase, venous phase. You can see the CT scan with the arterial phase and venous phase. The contrast enhanced CT of the kidneys with excretory phase, posterior and arterial views. Excretory phase, you can see the contrast which is excreted downstairs to the lower urinary tract, and here's also the anterior and posterior. Multispiral computed tomography, coral stone of the kidney. Here it is. The three-dimensional reconstructed computer tomography imaged of the ureteric stent in the left kidney. Here it is, our ureteric stent, and also the stone and the second stone. The Stackhorn stone, here it is. The 3D reconstruction with the stone, here it is, and the normal kidney with contrasting. The CT stone of the middle third of the left ureter. Here it is the stone and the left ureter, which is enlarged, and the pelvis also enlarged. Excretory face CT. You can see the stone, and this the extraction of the contrast, and here it is normal. The renal CT 3D reconstruction of the Stackhorn stone. So MSCT, multispiral CT, coral stone of the right kidney in the ureter of the stent. You can see the stent and also the coral stone. The MSCT Stackhorn stone of the right kidney sagittal projection. Here it is. The surgical treatment of the ureteroscopy. Here we can see. There is the ureteroscopy, how we do this and what we can see. What we have seen the next. The surgical treatment like PCNL, percutaneous nephrolithotripsy. Let's see what we do. There is how we do the percutaneous nephrolithotripsy. The shockwave lithotripsy. Thank you for your attention. See you up on the next lessons.